And so once that releases, then of course I go to the other side and just dig my fingers up into these 2 points and just light pressure and just hold, and it will release. And of course, do not talk while you're doing this. Okay, now I could go to governing vessel 15 right here, and I'm going to do a viper's head mudra position, and I'm going to touch at bladder 11 with the viper's head mudra, and this is going to straighten out the spine a little bit and clean out the conception, or the governing vessel and the bladder. Because I'm actually doing a half lotus here, and my pinky and index finger are going to be on bladder 10, and so got bladder 10 and 11 and governing vessel 15 covered. So governing vessel 15, bladder 10, and bladder 11. And after I do this technique, I can move down about an inch, or actually move up the spine. And there's an extra point here. It's not associated with meridian. It's called Ding Chong, and it helps with breathing problems, especially asthma. But it's not connected to any of the meridians. It's its own point, or any of the main meridians. So now we got that worked out. Okay. I'm going to check, and everything's feeling pretty good. And I don't want to dig my fingers into the side of his neck. I just kind of want to just move a little bit. And so I can feel maybe there's a little tension right here on the jaw. And so you'll find people who have like TMJ. So I'm going to go a little bit further down the jawline, which is fine. In fact, I mean, you can really trace all the joints and bones with this technique, and clean out the joints. A lot of sickness accumulates in the joints, and so he could have some jaw problems. His jaw may hurt from time to time. Could be caused by a toothache, and what's actually causing the pain from the toothache could be a contracted muscle. There's not enough blood getting to the tooth because of infection blocking either blood or energy, and thus causing pain. And so that feels good. And so now I can come up underneath the neck, and you can't see where my fingers are going, but it's going to go right in here at the stomach 11, where the clavicle connects to the manubrium. And I'm just going to hold my fingers in this point. It's a very sensitive point because it's via its connection to the heart, and it's a method of starting the heart if they've passed out. But I cover that in other videotapes. And I take my thumbs and I want to put them into gallbladder 20. So I have my fingertips in stomach 11, and I have my thumbs in gallbladder 20. And so this is going to make a connection to relax the muscles like the sternocleidoid mastoid muscle and a lot of the other muscles in the neck. And I can feel that releasing. And so now I'm just going to swipe off, because that's all there is to it, to clean out the neck area. And now the shoulders are relaxed, the neck is relaxed, and very, very simple. Not much to it at all. It's just be slow, take your time, be steady, be consistent, and feel. The feeling is everything. If you feel with your fingers, feel with your energy. The feeling is everything. So the more sensitive you become, really the more powerful you become, and vice versa. So it's all there is for the back of the neck and and cranial.